Hi, everyone. Thanks for joining us today. This is Monica Walker. I am Vice President of Chronic Care Management Services here at Harris. We have a very special guest with us today, Dr. Joshua Barron, who has been working with virtual care and chronic care management services for many years. He is the subject matter expert at EHR, a partner for CCM. So he's going to be walking us through some slides today that talk a little bit about chronic care management services, what that entails, how it's billed, and then also how we're going to implement that here within your prognosis program. At the end of that discussion, I'm going to do a little bit of summary for everyone, just hit some of the high points, and then we'll open it up for questions. In our last session, we had quite a few questions. So we scheduled this for an hour today. We probably have about 15, 20 minutes worth of presentation. So lots of time for questions at the end. If you want to, go ahead and type those questions in the chat. We will try to get through everybody's questions during the end of the session today. So with that, I'll turn it over to Dr. Barron.
Great, thank you so much, and good day to everyone. Just make sure, can you see my screen, everyone?
Yep.
Perfect. Okay, so again, welcome to the presentation. Thank you for coming to join us today. For those of you that aren't quite familiar with EHI, Enable Healthcare, we are a company that's been around for about 15 years, started as an electronic health record company. And over the years, especially in the past few years, we've really taken a shining and have developed expertise in working in the virtual care realm, including things like chronic care management and remote patient monitoring. And so today what we'll do is we'll focus on chronic care management and what that program is and how it can help your practices, your patients, and how it's good for healthcare in general. So again, what I'll address here will be what the chronic care management program is, how it benefits the patients, physicians, and payers. We'll talk about the strength of the CCM clinical staff, and we'll talk about the process involved with kicking off chronic care management within your practice itself. So let's begin with the first question. What is a chronic care management program? Well, this is a program that was developed about, 5 years ago that CMS had developed initially. And the idea was to bridge the gap in patient care. So they were noticing that lots of patients were ending up unnecessarily in the ER or being hospitalized, and they came up with this idea of the chronic care management program. And fortunately, it's been a tremendous success in that CMS has actually proven that patients are less likely to be admitted to the hospital or end up in the ER when there's the ability for early intervention in symptoms. So the way this works is basically we would develop a care plan that's based upon the chronic conditions that a patient has. And then there's CCM engagement at least once per month with each of the patient participants. And through this, they would receive either a phone call or a text message that would reinforce the care plan and essentially increase compliance of the patients. And the great thing about this is that because it's been so successful, not only is CMS involved in the program, not only is it a Medicare program, but several commercial payers have also adopted the program to help keep costs down. So in order to qualify for the CCM program, a patient would need to have 2 or more chronic conditions that are expected to last at least 12 months or until the demise of the patient. Those chronic conditions need to place the patient at significant risk of death or acute exacerbation or decompensation or functional decline. And it's great that they were able to provide such a broad definition, because we can think about those things that are nasty and are likely to lead to the demise of the patient, like cancer or heart disease. However, it also includes diagnoses that can, wax and wane, such as depression or anxiety. So the way it would work is once a patient's enrolled, we would develop the comprehensive care plan, and that is initially established, but it can be implemented, revised, monitored over time. So some examples of chronic conditions that can be included in the program would be Alzheimer's disease or other dementias, osteoarthritis, rheumatoid arthritis, atrial fibrillation, cancer, cardiovascular disease, depression, diabetes, hypertension, and chronic infectious diseases such as HIV/AIDS or hepatitis or infectious hepatitis. So the nice thing about this is that this is going to increase your direct revenue. And so the idea here is that CMS has, again, determined that this is a valuable program. And so they've actually increased their reimbursements this year up to $59 to $210 per patient per month. There is, of course, a decrease in ER visits and unscheduled hospitalization, which leads to a decrease in overall morbidity and overall mortality. So if we look at the potential for your practice, let's say that you have even just the Medicare enrollees. You have 500 Medicare enrollees in your practice. And again, I think that's probably a small number for most practices. And let's say that 80% of them have two or more chronic conditions. So we're talking now about 400 patients. Still a pretty small number. But then if we look at the monthly reimbursement, we're looking at about $60 per patient per month. That is variable by area. So on a monthly basis, you could be reaping as much as $24,000, on a yearly basis as almost $300,000 to be involved with the chronic care management program. Of course, when you have phone calls to the patient, text messages to the patient, you get their attention. We're able to ensure that patients are compliant with their care plans, that they're attending all of their visits, taking all of their medications, that they're not having side effects on the medications. With this, your quality measures will go up. So if you follow MIPS, if you're enrolled in the MIPS program, this will tend to increase your MIPS values and basically improve your value-based care measures as well. Again, indirectly increasing your revenue. There have been shown to be fewer hospital admissions and ER visits. This has been researched, looked at, and in fact, it does that. So that means that care can be managed in the outpatient setting. So instead of sending the revenue down the street to the local ER or hospital, that revenue is coming through your front doors. And of course, interventions can be early to prevent debilitating conditions. Patients love the fact that they are being called, that their clinic is taking an interest in them on a personal level, and of course, decreases gaps in care. And I think, the other point I would make is that over the past 2 years with the pandemic, there's been an increasing demand for virtual care. And one of the things that we're seeing is that patients are interested in programs like chronic care management simply because of the fact that it can keep them home and healthy and they don't have to worry about ending up in the ER. Ideally, it provides them another way to reach out to their providers as well, and for us to check in on them. So the hallmark of the CCM billing is a 99490 code, and that provides that pays $59 to $84 per month per patient. Again, that's based upon the 2022 increase, and that's for the first 20 minutes of time spent speaking with the patient or working on the care plan. Now, let's say that you end up spending more than 20 minutes. You can also build a 99439 code, and that can be built up to twice for thresholds reached of 40 minutes, again, speaking with the patient and working on the care plan, or it can be built once for the threshold of 40 minutes, built twice for the threshold of 60 minutes, again, working on the chronic care plan and also having those conversations and text messages with the patient, him or herself. And then each allotment of the 99439 will pay $44 to $63. That is, again, variable by region. But let's take, for example, a patient who is in New Jersey that requires 40 minutes of time on calls or revision of the chronic care plan. The way this would work is in that month, you would bill the 99490 code, which again, in the state of New Jersey, pays about $70. And then you would pay the 99439 code or bill the 99439 code once for $52 for a combined revenue of $121. If we were to reach that threshold of 60 minutes, we would be able to bill that 99439 twice for the combined revenue of $173. Let's talk a little bit about the kickoff process. So now you've decided that the chronic care management program is in fact helpful to your practice and you'd like to start. Well, what does that look like? So the first thing is that we'd educate your clinic, your providers on the roles and responsibilities. And I would say anecdotally here, the practices in which we have the greatest success are the ones where the practitioners are able to talk the program up with their patients. If the patient comes in, you notice that they have 2 or more chronic conditions, that they have a healthcare plan that will pay for chronic care management, just mentioning to them the fact that there is this program, it'll help keep you home and healthy, and it's fairly easy for them that they can expect having the conversations with our nurses on at least a monthly basis. We would then go on to perform data migration from your EHR to our CCM platform, and we would determine for you which patients are eligible for the program. We would then help you promote the program. So again, as a provider, you're going to talk the program up, but we'll also send an introductory letter to the patient. We'll send a postcard campaign to the patients, and we can also provide posters for your office so that patients see information about the chronic care management program. They might ask you questions about it, and so they can begin the conversation as well. We would teach you how to use our CCM app. And then finally, again, in the interest of promoting the program, we would ask you as a provider for a recorded message that we would use as an auto dialer call to all of your patients that are eligible for the program, where you would discuss the program briefly and let them know that it's something that the office is starting to do. Again, the more buy-in we have from the providers, the better the program ends up being for you and for the patients. We would want to get on a call to understand your patient demography, and that includes socioeconomic status, any concerns that you might have regarding your patient compliance, and of course, we'd want to understand what languages are spoken by your patient. And that's important because we do have multilingual nurses, and we want to ensure that we make the patient most comfortable in our conversations by speaking in their primary language. We would then provide the chronic care management care plans based on evidence from the medical literature. So institutional guidelines, for example, and of course, based upon that, the provider can modify for any specific patient what the chronic care plan would look like. On that call, we'd also introduce our care coordinators and establish the number of practices that you have, the after-hours service protocol, and specific nursing instructions. I should mention here, by the way, that the chronic care management program is meant as a two-way street. What do I mean by that? Well, part of the chronic care management program, of course, is for us to reach out to the patients, but the chronic care management program, by definition, provides a phone number to patients so that they can reach out to the nurses 24/7, so that allows them to make contact when they have concerns as well. Again, this is just another way for us to be informed about the patient status and to intervene when there are issues. In terms of our ongoing support, we really excel at this. So we provide an ongoing data migration at least monthly. The idea here is that when you have new patients joining your practice, we'll know about them and we can determine which new patients are eligible for the program. Additionally, if we have patients that had one chronic condition, but now they have 2 or 3, we can add them to the mix as well as candidates for the program. We'll also have bi-monthly meetings to review our experience with the patient compliance within the chronic care management program for your practice. We'll review the financials and then finally review those patients that have not been seen in the prior 9 to 12 months. And that's important because in order to qualify as a patient for the chronic care management program, it is necessary to have seen the patient in the prior year. So we have a very experienced clinical staff. We've been doing this since 2016. And the way we like to think about our CCM staff is as an extension of the practice's staff. So we think of ourselves that way. We are representatives of your practice. So the nurses, again, will engage the patients in the patient's primary language. That just makes sense, right? There's no issues with communication. The patient is put at ease. Our nurses will assist maintenance of the care plan. We will construct the CCM note on your behalf. And then at the end of the month, the physician would review the note and sign off on them. And finally, once again, when patients have concerns, we are available for them as part of the program. Let's say that we don't hear from the patient, but it's time to reach out to the patient. Some of the things that we'll review will be the patient's medications. So do they need refills? Have they had adverse effects on the medication? Again, sometimes, you know, the patient may come into the office and they might forget that they're having side effects from it. So on these calls, we can really kind of capture that and kind of go through the potential side effects for the medications that they're on and ensure that they're still healthy and feeling okay on the meds. We'll talk through common signs of disease exacerbation. So in a patient with diabetes who we thought might be well controlled, well, are they having excessive urination? Are they having excess thirst? That might indicate that their diabetes is starting to go out of whack. Have they visited the ER? Have they been hospitalized? And then we'll talk about socioeconomic aspects of patient care, as well as barriers to care. So for example, is a patient able to provide adequate nutrition for them? And if not, in the past, we've actually hooked patients up with Meals on Wheels. Is a patient able to have transportation to get to their doctor's offices? We'll ask several disease-targeted questions. We'll detail any gaps in care, make sure that they're getting the vaccinations that they need, that they're showing up for their scheduled tests and procedures. And then we'll be able to see the schedule of visits and encourage the patients to attend the visits as scheduled. So when will our nurses communicate with your practice? Well, for one thing, if a patient requires an appointment and knows that, we'll help arrange that. We'll act as a bit of a liaison to get that arranged for them. If the patient needs refills, certainly if the patient expresses any concerns medically or otherwise that might warrant a visit. Obviously, if the patient has an emergency room or hospital admission, we would want to convey that to you. We would also be responsible for transitional care management. Finally, if the patient's been screened, for example, for depression or their fall risk, and the result that we get back is either alarming or significantly different than the last time we discussed that with the patient, we'll let you know. So I'll stop there to open the floor for any questions that you might have. And if certainly we would love to hear from you now, or if not, you can always address us at teamharris@ehieh.com. And actually, let me turn the floor over to Monica for a second.
Yeah, absolutely. Thanks, Dr. Barron. That was great. Just a little summary for everyone. Basically, our goal here is to make this really easy for your practice. We're going to do most of the work for you. So we're going to identify the patients that are eligible from your prognosis database. We're going to invite those patients to enroll with your assistance. Obviously, we want to make sure that the letter that we send to the patients you guys approve of. We're going to have your providers record a voice message that we're going to send the patients. So that's as much help as we really need, other than obviously educating your patients at the practice, at their visits. We're going to invite those patients to enroll. Obviously, our care managers are going to conduct the care, give those patients 24/7 access. We're going to improve the information that you have in your hands. We're going to make sure that their medications are reconciled. We're going to give you any kind of values or anything that we have gathered from those patients during the course of their care during the month. Our goal is to improve the patient's access to care. Obviously, that's going to improve their satisfaction with your practice because they're going to have more touch points outside the visit. Obviously, for your practice, that's going to take some of the burden off of your nurses, one, from having to handle the calls 24/7, but also just providing answers to questions that commonly happen in between visits. It's going to take some phone calls off of your front desk and off of your clinical staff. Our goal is to reduce hospital admissions And we want to make sure that we continue to make that easy from you. We can scrub and bill the claims for you. And we can also basically start this program for no upfront cost. We're going to charge you when the money is collected from the insurance companies. So there's no cost upfront, no barrier to your practice getting this program started. Again, we want to make it as easy as possible. All right, so from there, if anyone has any questions, if you'll type those in the chat. I did have a couple of questions that have been emailed actually in prior to the meeting, one of which we've already covered. Is there 24/7 access to coverage? Yes, for the CCM patients. As Dr. Barron mentioned, there is coverage for those patients to be able to call and ask care manager questions. What specialties does this apply to? Obviously, for primary care providers, this is going to be a really good fit. And then also for specialties, so cardiology, pain management, neurology. If you're having regular touch points with patients, if you are regularly treating the patient and would have access to their care plan or be the provider to provide a care plan for those patients, those specialties fit really well. There are quite a few specialties actually that fit well for CCM. So if you have any questions regarding that or anything else, you're always welcome to reach out. We also had a question about insurance plans. So Medicare obviously covers this. We also have Medicare replacement plans that will typically pay for this service. Before we start the program, we'll pull all of the Medicare replacement plans in your area to confirm which provide coverage and which do not. So we'll have an idea up front of what we're looking for. And I just had a new question add. Can we explain what it is, the extent or participation from the practices? Dr. Barron, do you want to take that one?
Sure. Obviously, we know that practices are busy. And, if you look at the literature, the American Academy of Family Physicians, for example, and several other institutions actually have spoken about the fact that, yeah, this is a great program, but, does anyone really have the time to do it? Well, AAFP, as well as several other institutions, have actually advocated for using outside sources to help with the program. So we want to make it as easy as possible for you, which is why we are the ones that construct the chronic care plan for you. Again, it's up to the individual physician to read through those and be able to see if there's anything special that they want for that individual patient. Again, one of the expectations is that you sell the program. You're able to talk to your patients about it, let them know that it's a valuable program. We do ask for that voice script so that we can send out the automated message. And then ultimately, after we call the patient, we write the care notes for you. Ideally, at the end of the month, the physician would sign off on those notes.
Great, thank you. And then I had one more question that was asked, and that was to whether they can see which patients are enrolled ahead of time and go through that list and provide any suggestions to us on either patients that were not excluded in that list. Maybe we didn't have their insurance coverage, loaded correctly in the system or something like that, or if there are patients that they don't want to participate in the program, Sure. Can they also let us know that?
Yes, we've done this several times in the past where a clinic has said, yeah, we're very interested. Let us, before you start contacting the patients, figure out who's eligible, show us a list. And, it's not uncommon that we get the practice's input and they say, oh gosh, don't call Mrs. Jones. There's no way she's going to want to hear from you. And that's fine. That's a reality of the situation. Certainly some patients are going to be more interested than others. And of course, it makes it easier for everyone involved if a practice knows a patient and knows that they will or will not want to participate in the program. So yes, absolutely.
All right. I think that answers most of our questions. If anybody has any additional questions they want to pop in the chat now, feel free. We'll stay on for just a couple more minutes to see if we have any more questions come in. And otherwise, we will let everyone have the rest of their day back.
As we're wrapping up, my colleague Jenny, who is actually one of the CCM nurses, is on the call. Jenny, is there anything that I missed or anything that you'd like to add in terms of the way the CCM nurses interact with patients, or the way the notes are written and the interaction with the practices?
Right. Yes, Dr. Byrne, I think you really went over everything, and I do like that you did emphasize on the participation from the actual practice. So, you know, with our nurses, that's the one kind of hesitation the patients have with our nurses, because, you know, once we start calling, they will come back to the practice and, you know, ask, who was that? Or, you know, can you tell me more about that person that called? So we need that kind of a reassurance from the practice base as well, to make this a successful program. You know, it's hard because, you know, we can't really see the patient, so they have to kind of trust in the nurses over the phone. So if they get that extra kind of like, okay, yeah, that's, you know, nurse so-and-so will be calling you, and just talk to her every month. You know, if they get that from the practice space, it makes that a little bit easier for the patients.
Great. Thank you so much, Jenny.
Thanks, Jenny. All righty. And we have one more question, and that is, what's the cost? So the program is tailored to fit to your practice. So if you have interest in starting a program, we're going to be sending a follow-up email to everyone. Our next step would be to schedule a call to look at your practice population, to see you know, how many patients we can estimate might be eligible, and then we will tailor the pricing program specifically to fit your practice. We are doing a bulk of the work, but we do share a majority, or at least quite a bit of the collections with the practice. So reach out to us and we'll be happy to schedule that call. Again, we'll be sending an email later today. You can also go on our website, which is harrisccm.com, and we have a lot of information there regarding the program, and also an email that you can reach out to us there as well. One more quick question that came in. Will we send a recording of the meeting on the email after? Yes, we will. We will publish this recording. I know sometimes people sign up for webinars and then don't have a chance to join, or maybe you're a provider and you need to get back to patients. So we'll definitely send a recording of this email, or this webinar later, to everyone who registered via email, so you can listen to this again at your will and see those slides. All right, looks like that wraps up all of our questions for today. Thank you, everyone, for joining us. Thank you, Dr. Barron and Jenny, for
Thank you so much.
presenting information.
Thank you. Thank you, everyone.
Yes, thank you. And we hope to talk to everyone about this program soon.